Greetings dear viewers. In this video, I would like to explain about the cytomegalovirus and its infections. The cytomegalovirus is a common viral pathogen involved in the congenital defects. I am Dr. M. Manikandan from the Department of Microbiology, Sacred Heart College, Tirupattur. Historically, the cytomegalovirus was first noticed in 1881 by a German scientist called Ribert who thought these particles may be representing protozoa. But he observed the characteristic cellular changes caused by the cytomegalovirus, including cell enlargement and the intranuclear inclusions, which was isolated from the kidneys of a stillborn infant with congenital syphilis. Later, in 1921, Goodpasture and Talbot were the first to suggest that the cytomegalo could be a viral particle. After that, in 1950, Smith and Velius showed that these infections may also occur in uterine regions. After the viral cultures, such as growing in cell cultures, three scientists, Weller, Smith, and Rowe, who are all independently isolated these viruses from man and also in mice, they cultivated these viruses in cell culture method in the year of 1956 to 1957. Presently, the cytomegalovirus has now become one of the most common opportunistic pathogen encountered in patients with immunocompromised infections such as AIDS or may also occurs in transplantation procedures. Introduction. The cytomegalovirus is a common viral particle identified in the newborn and causes infection. The infectivity range is around 0.5 to 2.5 percentage. Once infected or encountered in our body, the virus remains as a part of our cell and it retains for our whole life. The cytomegalovirus is a most common viral agent which causes congenital defects in babies. The replication is comparatively much slower than herpes simplex virus. The virus exhibits latency in myeloid stem cells, monocytes, lymphocytes, the stromal cells of the bone marrow, and it also found in many other types of tissues. Classification and the structure of the cytomegalovirus. The virus belongs to the order Herpes virilis, family Herpes viridae, the subfamily Beta Herpes virinae, and the genus Cytomegalovirus. Structurally, the cytomegalovirus is a spherical enveloped virus with a icosahedral geometry, and the diameter is around 150 to 200 nanometer. The cytomegalovirus is also known as human herpes virus 5, which is the largest studied virus in this family. The genome of this virus is a double-stranded DNA genome and the largest genome found in the human herpes virus family with 230 kilobases of genes. The structure of CMV includes outer lipid bilayer envelope composed of viral glycoproteins. The layer between envelope and the capsid is the tegument, which is a proteinaceous matrix that holds the DNA core, and the icosahedral nucleocapsid contains the double-stranded linear DNA core, and capsid is of 960 angstrom in diameter, composed of 162 elongated hollow capsomeres. Transmission of a cytomegalovirus. This virus has various modes of transmission, including perinatal transmission, that is from mother to infants. The second one is the children to children transmission through saliva and urine, which has more exposure opportunities of this virus in the daycare setting and also with the infected children to their parents and nursery workers. The transmission also may occur through sexual activity and transfusion of blood and blood products. That is, transfused red blood cells, platelets, granulocytes may also contain this human cytomegalovirus. The transplantation can result in significant morbidity and mortality in preterm infants and allograft recipients following cardiac surgery and other immunocompromised hosts through this virus in the transplanted organs. HCME may also transmit through artificial insemination by donor semen. The congenital, oral, and sexual routes, blood transfusion, and tissue transplantation are the major means by which cytomegalovirus gets transmitted from one person to another person. After the transmission of this cytomegalovirus from one infected person to another person, the virus undergoes replication in the infected host. In contrast to the traditional definition of a virus, which states that a virion particle contains DNA or RNA, this cytomegalovirus carries specific mRNAs into the cell in the virion particle to facilitate infection in the infected host tissues. Human cytomegalovirus replicates only in the human cells like fibroblast cells, epithelial cells, granulocytes, macrophages, and other cells that are permissive for the cytomegalovirus replication. Virus replication is much slower than for other herpes family of viruses, and cytopathic effect may not be seen for nearly 7 to 14 days. This particular efficiency of this virus may facilitate the establishment of a latent infection in myeloid stem cells, monocytes, lymphocytes, the stromal cells of the bone marrow, and or in other pathogenesis of the cytomegalovirus. This process is more or less similar to that of other herpes virus in many responses. Cytomegalovirus is an excellent parasite and readily establishes persistent and latent infections rather than an extensive lytic infection. Cytomegalovirus is highly cell associated and is spread throughout the body within the infected cells, especially lymphocytes and leukocytes. The virus is reactivated by immunosuppression, that is, by utilization of more corticosteroids or infection with HIV like viral infections, and possibly by allogenic stimulation, that is, the host response to transfused or transplanted cells. Cell mediated immunity is essential for resolving and controlling the outgrowth of cytomegalovirus infection. However, cytomegalovirus is an expert at immune evasion and which has several means for evading innate and immune responses. Cytomegalovirus infections alters the function of lymphocytes and or leukocytes. The virus prevents antigen presentation to both the CD8 cytotoxic T cells and CD4 cytotoxic T cells by preventing the expression of MHC1 molecules on the cell surface and by interfering with the cytokine-induced expression of MHC2 molecules on antigen-presenting cells, including the infected cells. Congenital infections. Cytomegalovirus is one of the most prevalent viral particle which causes congenital diseases. The disease signs of cytomegalovirus includes small size thrombocytopenia, microcephaly, intracerebral calcification, jaundice, hepatosplenomegaly,
and rashes, that is, the cytomegalic inclusions, characteristic signs and symptoms. This may also lead to unilateral or bilateral hearing loss in the newborn babies, and mental retardation are common consequences of this congenital cytomegalovirus infections. These are all due to the transmission of virus through perinatally from mother to baby. This causes serious birth defects, which is very much extremely high. Perinatal infections. That is, if a pregnant woman, when she harbors the cytomegalovirus through sexual activity or blood product transfusions in the cervix, which may cause a reactivation of this virus during pregnancy. Approximately half of the neonates born through an infected cervix acquire this cytomegalovirus infections, and they become excretors of the virus at 3 to 4 weeks of age. Neonates may also acquire cytomegalovirus from maternal milk or colostrum. Perinatal infection causes no clinical evident diseases in healthy full-term infants. Significant clinical infections may occur in premature infants who acquire cytomegalovirus from transfused blood, usually resulting in pneumonia and hepatitis. Infections and transfusion and transplantation. Transmission of this cytomegalovirus by blood and blood products most often results in asymptomatic infection. If symptoms are present, they typically resemble those of mononucleosis infections. Fever, splenomegaly, and atypical lymphocytosis usually begin 3 to 5 weeks after transfusion of this blood and blood products. Pneumonia and mild hepatitis may also occur. Cytomegalovirus may also be transmitted by organ transplantation, that is, transplantation of kidneys, bone marrows, and in this cytomegalovirus infections is often reactivated in transplanted recipients during periods of intense immunosuppression. Cytomegalovirus disease of the lung causes pneumonia and pneumonitis, which is a common outcome in immunosuppressant patients and can be fatal if not treated. Cytomegalovirus often causes retinitis, colitis, or esophagitis in patients who are severely immunodeficient, that is, patients with the AIDS infection. At last, interstitial pneumonia and encephalitis may also be caused by cytomegalovirus, but may be difficult to distinguish from infections caused by other opportunistic infections. Cytomegalovirus gets transmitted to the esophagus region, which may cause esophagitis in that site, which may mimic the candidal esophagitis infection. A smaller percentage of the immunocompromised patients may experience cytomegalovirus infections, which is found in the gastrointestinal tract. Patients with the cytomegalovirus colitis usually have diarrhea, weight loss, anorexia, and fever. Effective anti-HIV therapy has reduced the incidence of these diseases. Cytomegalovirus is also responsible for the failure of many kidney transplants. This may be the result of virus replication in the graft after reactivation in the transplanted kidneys or infection from the host. Laboratory diagnosis of cytomegalovirus infections. We may perform histological experiments to identify the cytomegalovirus. The histological hallmark experiment of cytomegalovirus infection is the identification of cytomegalic cells, which is an enlarged cell of around 25 to 35 millimeter in diameter, which contains a dense central owl's eye resembling basophilic intranuclear inclusion bodies. The infected cells may be found in any tissue of the body, and in urine and are thought to be epithelial in origin. The inclusions are readily seen with the Papniclov or hematoxylin eosin staining. ELISA and PCR is a other powerful methods for identification of cytomegalovirus. The virus can be cultivated in diploid fibroblast cell cultures, which shows the owl's eye resembling cytopathic effects in the cultivated tissues.
Treatment drugs for the cytomegalovirus infections include ganciclovir, which is also known as dihydroxy propoxymethyl guanine, valganciclovir, which is a valyl ester of a ganciclovir, cidofovir, and foscarnet, which is pasponoformic acid. The ganciclovir is structurally similar to acyclovir. It is phosphorylated and activated by cytomegalovirus encoded protein kinase, which inhibits the viral DNA polymerase and causes DNA termination. Ganciclovir can also be used to treat severe cytomegalovirus infections in immunocompromised patients. But the problem with that is it is more toxic than acyclovir antiviral agent. The foscarnet is a simple molecule that inhibits the viral DNA polymerase by mimicking the pyrophosphate portion of the nucleotide triphosphates. This is all about the cytomegalovirus and its infections. Thank you for your patience listening. Kindly share and subscribe our YouTube channel. Thank you.